Where interact cavity located heart?
Mediastinum.
Where in what mediastinum? No, it's in what mediastinum? Anterior mediastinum.
Anterior mediastinum,
In
obviously.
anterior mediastinum. Так, Prem, listen. Why you sit? Listen. In anterior mediastinum. Interact cavity in anterior mediastinum. This is correct position. Don't know why it's happening. Maybe this is not
Fresh.
No, this is fresh. You can see this is fresh. If we say about structure, have apex cordis, and basis cordis. Apex looking down, left, and little front, and base looking back, right, and behind, and up. Yes, and up. This is correct position of heart. If we say about apex, the left ventricle making apex. If we say about a base make two atrium, aorta, and pulmonary trunk. How many chambers? Four chambers have two atrium and two ventricles. Two atriums and two ventricles. First, we look at the picture and then I show you. Сейчас я bring on the. This is picture in front, this is picture behind. 1, 2, 3, 4. 1, 2, 3, 4. Two ventricles, two arteries. And they have a border. This is, all see. This is. Sulcus coronarius. This groove dividing atriums upper and ventricles below. Understand? Sulcus coronarius. And then we should dividing two ventricle, right and left. We have sulcus interventricularis posterior, it's posterior picture, and sulcus interventricularis anterior. So if we look, this is sulcus coronarius, coronary sulcus. You can see the artery located in this groove, coronary artery, yes. So this is sulcus coronarius. This is two more big ventricles. This is two small arteries, not auricle, arteries. And then two ventricles, groove, this groove. Auricle is another atrium. Atrium, yes, atrium. And then sulcus longitudinalis anterior, where located the artery and vein dividing ventriculus dexter and ventriculus sinister. Or if we're looking back, we can see sulcus interventricularis posterior dividing the right and left ventricle. You say, yes. До свидания. Так. So, the border between arteries and ventricles, sulcus coronarius, this is. If we look on another heart, guys, this is sulcus coronarius, dividing ventricles and arteries, yes. And then two ventricles dividing sulcus interventricularis anterior and posterior, yes. This heart. Sulcus atrioventricularis anterior and sulcus atrioventricularis posterior. We say that heart have four chambers. Firstly, we discuss the right half and then the left half. If we say about right half, the first part, this is right atrium dexter. You can see inside it's flat, but auricula, this is auricula dextra. Auricula, this is part of atrium. This is additional reservoir for blood, additional cavities for blood. This is auricula dextra. And if we're looking inside auricula dextra, we can see the muscles. This is musculi, because a lot of muscles. Pectinati, this is musculi pectinati. If I take just This is auriculus dexter. This is auriculus dexter. Auriculus is part of right atrium. Сейчас. This, yes. Please. Vena cava superior, vena cava. This is the right atrium. This is musculi pectinati, located in the auricula dextra. No, on this auricula it's more. This is auricula dextra. This is sinistra. The left atrium have auricula sinistra, looking like ear, so-called auricula. This is dextra. And inside this auricula have musculi pectinati. And if we say about right atrium, in right atrium flow two veins, vena cava superior and vena cava inferior. These veins I show you on this heart, because on this we delete the upper part. Сейчас. Так, this is, guys, vena cava, vena cava superior, and at this place should exit vena cava. They going, you can from inferior vein passes to superior vein like this. So this is vena cava superior, and this place should be vena cava inferior. If we look at the picture, vena cava superior, vena cava inferior. Superior number 7, inferior number 17. And you can pass it from superior to inferior, yes. Vena cava superior, vein flat. You see how looking arteries and how looking veins flat. So vena cava superior, vena cava inferior. If we take another card, vena cava superior, no, and should exit vena cava inferior. So vena cava superior and vena cava inferior have the openings. Ostium vena cava superior and ostium vena cava inferior. And between two arteries located the septum interatrialis, where located the fossa avalia. This is septum interatrialia between right and left atrium, and on the right side looking fossa avalia. Fossa avalia disclosed the humans, and in the just I read in English how it's writing. Just where. 1 second. Yes. This is our ground oval window that functional during fetal development. But unfortunately, sometimes this is not fossa, this is opening foramen, and blood from right atrium and left atrium mixes. Yes, mixes. So this is problem. In normal, it's fossa. That closed when person birth, it's closed. But sometimes, unfortunately, it's stay open. Yes, fossa avalia. And near ostium vena cava inferior, we can see the sinus, ostium sinus coronarius. Coronary sinus is place where all blood of heart accumulate in one place and then passes in right atrium. This is sinus coronarius, located in the right atrium. And about right atrium, this is all information. Then, if we talk about the right ventricle, we have a border between right atrium and right ventricle. Ostium, opening. Ostium atria ventriculare dextra. Ostium atria ventriculare dextra. And this ostium have a valve. Valva tricuspidalis. All understand valve? Tricuspidal valve. Have tricuspidal valve. Tricuspidal mean have three leaflets, three cuspids, anterior, posterior, and septal. Anterior, posterior, septal. And if we're looking inside, we can see how looking the cuspis. This is cuspis. And tricuspidal vault called tricuspidal because contain three cuspids. Three leaflets. All understand what mean leaflets? Anterior, posterior, and septal. Then if we say about the right ventricle have a pulmonary trunk, truncus pulmonaris, and this pulmonary trunk have opening, ostium trunci pulmonalis. And if we're looking inside, this is how looking, have a semilunar leaflet, semilunar valve. Yes. Have three cuspids also too. Cuspids anterior, lateral, and medial. Anterior or posterior? Check, please. Anterior.
Anterior.
Yes. Так, all anterior, lateral, and medial. Correct. They looking like pockets. All see. This is
Yes.
anterior.
Right and left.
This is right or left.
Left.
This is right. Yes. Anterior, left, and right. 1, 2, 3. Anterior, left, and right. They're looking like moon. So this is semilunar valves.
Okay.
Cuspis semilunaris. Anterior, dexter, and sinister. So only pulmonary trunk and aorta have semilunar valves. Ostium interventriculare dexter and sinister have more round, not semilunar. So remember, semilunar valves have only trunci pulmonaris, pulmonary trunk, and aorta. Так. Then, if we're looking inside the right ventricle, we can see that this is cuspis, yes, leaflet, cuspis of tricuspidal wall, and this is a tendon threads, horda tendine. All see, guys, this is how looking, very, very careful. Horda tendine, and then this one, a lot of, and this horda attached to the muscles. Papillary muscles, free, because we have free leaflets, so we have free muscle. And when muscle contract, these threads, tendon threads, like this, closing, look.
And opening the valve.
Yes, closing and like this, closing and opening the valve.
Okay.
So we have free pectinal muscles, musculi, papillary muscles, papillaris, right, left, and anterior, like called the leaflets. Oh, not right.
Right ventricle, anterior, posterior.
Anterior, posterior, and septal. Yes, anterior. I confused with pulmonary trunk. Anterior, posterior, and septal. Yes, sorry. Oh, sorry. So revise. This is cuspis. Yes, leaflet. This is horda tendine, and this is papillary muscles. No, difficult. No, papillary muscles. Muscle. Show. No, muscle, they located in the thickness. Pulmonary, papillary muscle. And when muscles contract, yes, the leaflets is closed. So this horda, one end ending on the muscle, one on the cuspis. Yes. And you can see another surface. It's not flat. It's half flashy crossbar. Flashy crossbar. Trabeculae cornea. I don't understand what is. I can't explain what is this on the study. I try explain on the group. You don't understand flashy crossbar. Trabeculae in Russian. No. No, it's looking. Yes, it's looking. Just. Вот, the inner surface of the right ventricle has fleshy crossbar. I think it's not half translating. The fleshy crossbar, this is trabeculae in Russian. Trabeculae, a lot of septum. You can see, looking. It's not flat. A lot of septum. So this is the yes, trabeculae cornea. This is trabeculae cornea. Так, and about right ventricle, this is all. And about right side, this is all. Yes, quickly revise. Right side have right atrium, right ventricle. Right atrium have auricula dextra with musculi pectinati. And in right atrium flow vena cava superior, vena cava inferior, flow the sinus coronarius and located the fossa ovale in the septum interanteriale, looking in the right side. Then between atrium and ventricle we have ostium in ostium atrioventricularis
Atrioventricularis
sinistra that contain the tricuspidal valve. Valva tricuspidalis have three cuspids: anterior, posterior, and
Septum.
septal. Yes. If you say about structure inside, yes, have hordy tendine, musculi papillaris, and trabeculae cornea. It's about structure inside. And if we say about right ventricle, exit the pulmonary trunk. If we on this heart very good looking, have three cuspids, two semilunar cuspids, right, left, and anterior front. Yes, yes. And about this side, this is all. Understand?
Yes.
Right side. Then if we say about left side, left atrium have auricula sinistra. If you looking inside, musculi pectinati. It's not flat. You can see, it's not flat. You can see how looking wall of left atrium and how looking the wall of the auricula of left atrium.
Yes, yes.
Musculi pectinati. And in left atrium flows 4 pulmonary veins. Just I show you on another heart because
Pulmonary veins.
4 pulmonary veins. One, this is vena cava superior more big. 1, 2, 3, 4. It's looking like this. 1, 2, 3, 4. Сейчас another part. Вот. 1, 2, 3, 4. Yes, this is 1, 2, 3, 4. Pulmonary veins flow. About left atrium, this is all. Then we have a border between left atrium and left ventricle. Ostium interventriculare sinistra. Contain a bicuspidal valve, mitral valve.
Mitral
valve. Have only 2 cuspids, anterior and posterior. Anterior and posterior. No, left wall not opened, but it have structure like the right ventricle.
Same अच्छे.
What are you
Or
saying?
similar thing. Like the right
Papillary muscles,
right ventricle.
anterior, posterior, and trabecular. Like
Similar to the right
yes,
one.
but have 2 papillary muscles because have only yes because
Mitral valve.
illogic.
Mm.
Another heart opening we have
I
сейчас.
think it's open from the below. This one. From the below.
Вот, сейчас, ну да. Trabecular cornea have, then horda tendine, and 2 papillary muscle, like the right ventricle, but have 2 papillary muscle, another similar. And what artery exit from left ventricle? Aorta, the most big artery in our body. And wall of left ventricle very thickness, very strong.
Yes.
Because function
It
of
has
left
to pump the
ventricle,
whole
yes,
blood to the whole body.
yes, you're right. So, if we say about aorta have ostium aorta that contain a semilunar valves too. Cuspis semilunaris, right, left, and behind. Yes, posterior, dexter, and sinister. You can look.
Yes.
How it's looking.
Can you show?
This is 1, 2, 3, 3.
Mhm.
How looking? Yes.
Just a second.
Cuspis dexter, sinister, and
Even
posterior.
on the third one.
Okay. Yes.
And posterior. What else about left ventricle? I not say. Все? No, and if we say yes, have nodules of similar leaflets, then dense strands, nodules of similar leaflets, it's like a horda tendine, helping have similar function, helping close and open the valves. And between the ventricles we have septum interventriculare. Have 2 parts, in front muscle part and behind membranous parts. Pars muscularis and pars membranaceae. And about structure of heart, this is all. How understand correct position? Firstly, apex.
Apex on the left side.
And this is up, then aorta and more big, and in front aorta looking pulmonary trunk. More big aorta, pulmonary trunk, aorta, and behind pulmonary veins and vena cava superior, vena cava inferior. If I take this heart in correct position, pulmonary trunk, aorta, behind 4 pulmonary veins and vena cava superior. If I take, for example, yes, this heart,
Yes, nahi.
pulmonary trunk,
Aorta.
aorta, 1, 2, 3, 4 pulmonary veins, and this is vena cava superior, no, and should be vena cava inferior. Yes, understand structure of heart?
Yes.
Так, then, yes, blood circulation. You know blood circulation?
Double circulation.
Double complete circulation.
Oh, yes. This information, I think you study in school. We have 2 blood circulation, systemic and pulmonary. Where
Yes.
begins systemic? In left ventricle.
Left ventricle.
In left ventricle originates begin the aorta, and oxygen blood, pink color, from aorta passes to all organs of our body. Yes, give oxygen, nutrients. Yes, and then making dioxygen blood and passes back to 2 veins, vena cava superior, vena cava inferior, and these veins flow in the right atrium, then passes to right ventricle, and systemic blood it's stop, yes, ending, and begin a small
Goes to the lungs.
pulmonary round. Small pulmonary round, respiratory round, begins in the right ventricle, exit the pulmonary trunk,
Goes
then
to the
going to
lungs.
root of lungs, yes, then passes to the acinus, gas
alveolar
exchange is
acinus.
present, and then this oxygen blood going back from the
Right
4,
atrium.
1, 2, 3, 4
Left atrium.
pulmonary veins.
Ah.
They flow in the left atrium, then passes to left
Left
ventricle,
ventricle.
and
Then
again
to the
systemic.
aorta.
Yes. Understand?
Mm.
Yes. No, don't. I think all of you know information. Then the wall structure. The heart have endocard, myocard, epicard, and pericard. If we say about pericard, it's like a pleura, peritoneum, it's serous membrane, pericardial sac. Outside have pericardium fibrosum, then have parietal and visceral sheet, between have a cavitas, 1 millimeter serous fluid, and the visceral sheet of pericardium called epicardium. Epicardium, this is a visceral sheet of serous pericardium. So epicardium, it's visceral sheet of pericardium. So firstly pericard, then epicard, and then myocard. Myocard, it's muscle tissue, represented by special striated muscle tissue, and on picture you can see they different in atries and in ventricles. This tissue different in atries and ventricles. If we and all muscle tissue begin in the annulus fibrosus, сейчас I show you what I mean. Annuli fibrosi. Can you please support? Yes. Annuli fibrosi. This is ostium truncipulmonaris, ostium aorta, bicuspidal valve, and tricuspidal valve openings. And these openings round have a fibrous ring. All of them.
Okay.
And this ring supports the valve, and in this place begin the muscle tissue. Understand?
Okay.
So if we say about atrium, have 2 layers, superficial and deep. Superficial circular and inner longitudinal. And superficial circular layer it's both. And inner circular is longitudinal inner. Different. Different. And separated right and left atrium. So the outer circular is common for 2 atries, and inner longitudinal different to right and left atrium. Understand?
Okay, good.
If we talk about ventricles, ventricles have three layers: longitudinal, circular, longitudinal. The outer longitudinal layer going down to apex and making a vortex. Vortex, this is, who can read what mean vortex? Explain. Vortex. Завиток in Russian.
Vortex of heart.
Yes.
Here they are bent loops like
Yes.
in depth.
मतलब हम
Forming
cover
a vortex
करेंगे
of heart.
meter.
It goes down and
Yes,
comes
yes,
up.
like
Hook
this.
type of, yes.
And
Okay.
outer longitudinal making inner longitudinal and between circular.
And continue into the inner
Understand?
longitudinal
Yes, yes.
layer.
Outer longitudinal, inner longitudinal, and middle circular.
Circular.
Understand? And you can see that ventricles have common, yes, not separated. Ventricles, myocarb not separated.
Myocardium is
Atrium,
similar.
yes, this is similar. Then, and the card, the folds of the card making a valve. No, valve, tricuspidal, bicuspidal, all this. Так, and about wall structure, this is all. Then conduction system of heart. This conduction system regulate the contraction of chambers of heart. And we have a good picture. 1 second.
Sinusoidal nodes. Yes.
In school,
પછી
I think
contract.
you
हाँ आवाज आई
read
प्रेम थोड़ा
about this. The first note, this is introduction. No, who begin?
Sinusoidal.
Yes.
ऐसे
Nodus
node
sina atrialis.
Sinusoidal node.
Begin in the wall of right atrium. And second node, sinus
AV node.
atrioventricularis. And between we have bundle
Bundle
of
of his.
Bauman's. This is Gisden.
yes,
This
yes,
is
yes,
Bauman's.
yes, yes.
Bauman's bundle.
okay
Nodus sina,
atrioventricular node
atrioventricularis. And then begin bundle. This is
bundle of his Purkinje fibers
Purkinje fibers.
Purkinje fibers, yes. Волокна Purkinje in Russian. Purkinje fibers ending in left ventricle and in right ventricle. Don't difficult. Understand?
yes
Then syncope. Anterior mediastinum below. Diaphragm located in front anterior chest, behind located esophagus and descending aorta. And from the sides, the pleura, mediastinal pleura located, yes. Skeletopy. Skeletopy not difficult, lungs more difficult than heart.
બે મિનિટ રહી જઈએ કે રડામાં સ્ટમક બે આલવું પડશે પછી કરી દઉં સ્ટમક ક્યાં હે
अलग है nasal cavity और एक
ये तो अलग है
Please.
હું તો ના આગળ નો
ये भी
Так. All look, guys. This is heart. All see red color.
yes
Apex, how we say, looking down, left
Yeah.
and front.
In anterior.
This is base, upper border, apex, right border, left border, lower border. Begin with the apex. This is linea parasternalis, yes. And 1 centimeter medially linea parasternalis to the 5th intercostal space correspond the apex of heart. This is apex of heart. Understand?
Yes.
5th intercostal space. I won't say 1 centimeter medially, the linea linea media. Yes.
મને લાગ્યું પેરાસ્ટર્નાલિસ બોલી તો ખરી
This is parasternal.
yes
This is media clavicularis. I confused. Yes, 1 centimeter medially, linea media clavicularis.
Clavicularis.
In 5th intercostal space. Then upper border located at the level of 3H of third costal cartilage. Yes, third costal cartilage. Then right border going from 3 to 5 rib along the line. This is linea parasternalis. Medially, the linea parasternalis from 3 to 5th rib. Then lower border from 5th rib to the apex, and left border going from the 2nd intercostal space and connecting with the apex.
okay
Yes, understand? So firstly you find the apex and upper, and then
This.
another you
Bottom.
connecting, like liver, like we discussed. Points, lines, Так, you should know. And last for today, blood supplied veins. Сейчас. If we say about
Next one.
blood supplies, veins and all. And this is all.
राइट केला भेज बाकी
Так, guys.
Yes, yes.
If we say about blood supply, we have two coronary artery. Arteria coronaria dextra and arteria coronaria sinistra. They beginning in front on the bulbus of aorta. Bulbus of aorta, this is beginning. Where originate the aorta? Firstly, take a correct position. This is arteria coronaria dextra. Are you see where I begin? This is arteria coronaria dextra. Lies located in the sulcus coronarius, then go back and making ramus interventricularis posterior. That located in the sulcus interventricularis posterior. Understand? Then second, this is arteria coronaria sinistra. Give two branch, ramus interventricularis anterior and ramus circumflexus. Ramus circumflexus going to the posterior surface and anastomose with the right coronary artery. And ramus interventricularis anterior and posterior anastomoses together on the apex and making anastomose. Understand anastomosis?
Connect.
Yes, connect. Так. So, for example, if one artery not working, second can take work for this. Yes. Anastomosis. About arteries, no difficult. Only two. Arteria coronaria dextra, arteria coronaria sinistra. On this heart more visible, I think. Arteria coronaria dextra, arteria coronaria sinistra. Yes. If we delete pulmonary trunk, we can see one, guys, one, two. Сейчас вот так вот берем. Артерия коронария декстра, артерия коронария sinistra. Sinistra give ramus interventricularis anterior and circumflexus. Yes, going behind. And right, going behind, go, is sulcus coronarius. And give ramus interventricularis posterior. Так, guys, where you going, larynx? Half of lesson you not present. Why, boys? Why you not present in lesson? Prem, what happened?
Okay.
What happened?
This take
It's